Where is the evidence for approving riding with people you know as opposed to in the household? Aerosolized, I can't say that word, particles are the biggest spread for healthcare workers. Why do you not take the safest hard line and say practice social isolation? We should not be visiting people or riding with people.
So again, that is, if you think this is going to last for 2 weeks, that's probably a rational approach. We can all put up with that. I don't think it's going to last for 2 weeks. I think this is going to be till June that we're going to be doing a lot of these things. And so again, if you're around somebody with no symptoms who is not at high risk and not at travel, I think it's a reasonable thing. Like I said, there's three classes. That the absolute safest thing is don't go outside, don't be around anybody, stay in your basement. If you can keep that up for 3 months, good on you. The next safest thing is to be reasonable about it. Try to make sure you know who you're riding with. And then the unsafe thing, I think, is to just ride with anybody there. It's also not true that the most common way that healthcare workers are getting exposed is aerosol. That's just not true. It's mostly droplet and contact. And that's been pretty well worked out since we've been doing this for a while. So the aerosol it's a possibility. It's just a weak possibility with this virus.
Awesome. Well, I don't see any other questions. What I do see is a number of thank yous. So thank you so much, Dr. Roshon, on behalf of USA Cycling, as well as all of the participants that are here. We're so grateful for the way that we are able to just learn from you and be able to continue to bring questions and concerns to you and walk away feeling a lot more sense of control. At least that's how I feel. And I can tell that some of these are saying that as well.
So I think it's reasonable to say ride outside either by yourself or in a small group, people that you know really well, people that you know have no symptoms, people that you know have not traveled to a dangerous area. And I think that's a reasonable thing to do. You could probably ride in a group of 3 or 4 people that you know well and have no risk of exposure to the virus. I would not recommend riding in a large group of people that you don't know and you don't know their travel history and you don't know what their symptoms are. So again, most safe thing to do is to self-quarantine and not ride outside. I don't think that's entirely reasonable. I think it's a reasonable thing to do is ride in small groups of people that you know. I think many of these races are now being canceled. I think that's the right thing to do. When you're having a bunch of people travel from all over the place to go there, you really are. It's impossible to self-quarantine and maintain social distance in a large race with people staying in the same hotel, people traveling on planes to get there. I think you need to be really certain that any travel that you do is really mission critical. And if you don't need to do it, don't do it. Get yourself a strategy that you can live with and think about your mental health. You know what it's like when you're locked down, when you've been sick or something like that, and you can't leave your house. It's not exactly non-depressing. So you want to come through this on the other end better prepared than anybody you're competing against. And there's 2 ways to do that. Don't get the virus. That's a really good way. And then come up with a strategy that you can live with, that you can perform through this. Getting that middle path of not doing nothing, but also not freaking out and trying to lock yourself in the basement for 2 months.